Hello, thank you so much for participating in the Wellness Wave brought to you by the ACP Southern California Region 3 chapter. My name is Chelsea Maduke, and today I'm honored to be interviewing Dr. Maher Roman. Dr. Roman, if you could tell us a little bit about yourself and what you do.
Oh, thank you, Chelsea. I appreciate the opportunity to participate with you and your team. I'm a general internal medicine specialist who practiced for about 3 decades now in areas of primary care, hospital medicine, academic medicine, including online teaching of health systems-based practice. Currently, I'm an associate professor of medicine at the University of California, Riverside, in the internal medicine hospitalist at a psychiatry hospital in the Inland Empire. Served as past president, California ACP, which is us here in California, all regions, about 12,000 members or so. And relevant to our conversation here, I was trained about 3 years ago as a well-being champion at ACP National, and I'm enjoying the work in this area.
Wow, you're so accomplished, Dr. Roman. So with all of that, how did you choose your career in medicine?
Well, quite frankly, I thought all along I wanted to be a surgeon. And then somehow internal medicine happened. After, well, it's a long story, but the short version of it, I realized internal medicine is really what I like. I love the intriguing cognitive nature of it and the patient-physician relationship. So what I thought I wanted to do all along was not what I really realized I wanted to do, and I have enjoyed for a long time now.
That's great. So what advice do you have for rising medical students and current residents as they're figuring out their own path in medicine?
In general, you probably heard this one, it's kind of like a cliche, do what you love to do. Because if you do, then you never work a day in your life. And internal medicine was what I wanted to do and pursue. And probably the career is like 40 years or so of like practicing what you would want to do in medicine. I would always suggest that keep an eye on your wellness, and your well-being. So with the areas of like at the physical level, mind level, social, spiritual levels. So this way you stay away from burnout with its, I like to call it ICE, and efficacy, cynicism, and emotional exhaustion, the 3 elements of burnout.
That's wonderful advice to hear. You talked about all the different hats you wore and are wearing. So what about all those things are you most passionate about?
I like to think about medicine in terms of like patient care, administrative part, research and teaching. Every part of the part is fun and joy. Definitely the most I cherish is the patient care piece.
Wonderful. How do you create a personalized toolkit to manage stress as a medical student, as a resident?
Most of the burnout issues are not because of you and me are not doing what's the right thing. Most of it are system induced, estimated 80%. We don't have shortage of resilience. Resilience or vitamin R, there's no shortage of vitamin R for us. We are resilient, and there's research to show that. Paper published in JAMA just a couple of years ago by Dr. West from Mayo Clinic and colleagues shows that. So if we try to develop a toolkit and something to work on, just think of it again individually. What can I do individually in terms like, paying attention to my physical wellness. On the mind side, that's physical, the mind side, even thinking about doing this mindfulness focused breathing, just 5 minutes twice a day. You are thinking positively, thinking about something you appreciate, being grateful for something around you. And then comes the element also on the societal level, society around you. Volunteering with ACP, for example, like you guys are doing now. Volunteering in your faith community, helping others, it has a remarkable value for making us feel well. Since 80% of the issues of burnout are really systems, we need to work on the system. We need to advocate. So you think about the basic element wherever we are in med school, in residency, in practice, under ACP, is forming this wellness committee, starting with the wellness committee and wellness champions, the local champions, champion the cause for wellness. And then start working on what are we going to do, what are we going to examine, and can we measure where are we with burnout. There are all formal measurement methods in research and so on, and there's also simple validated ones, like simple 2 questions as a screening with 94% sensitivity. Like, do you feel you're burned out? And have you become callous toward the people around you? Just 1, 2 simple questions. If you can measure, then hopefully you can work on improvement and see what intervention. Things don't have to be necessarily very complicated. Just people getting together, eating together, thinking about what issues around them and talking and thinking about solutions. So just think about self, but also the system, and really you can influence yourself and do better with yourself, you and me, and the system overall. And then we can make it better and we'll move forward. And we're not alone in that. Together we can make a difference.
Well, thank you so much, Dr. Roman, for sharing your knowledge and your insight. I know our viewers will definitely benefit from the advice you shared.
Thank you so much, Chelsea, and best of luck to you, and stay well.